Colby?
Yes.
Hey, my name's Ann, and I'm the registered dietitian here at the hospital. It's nice to meet you.
You too.
So I was looking at your charts, and I saw you were having you had history of a stroke, CVA, about a month ago, and that you've recently had some chest pain and difficulty swallowing. Could you tell me a little bit about that?
Yeah, I've been having chest pain when I walk, and it's been hard to swallow some meats, and bread can be difficult.
Okay, and how about the weight loss? Have you lost any weight?
About 10 pounds.
Okay, gotcha. So that is significant for a month. Could you tell me a little bit about what you eat in a day?
I usually eat sausage biscuits for breakfast, and then I'll eat a pizza for lunch, and I eat eggs and sausage for supper.
Gotcha. All right. Let me write that down. Okay, if you would, I'm going to go ahead and take your weight and your height over here. If you could step on that scale for me, please. 173 pounds. All right, stand against the wall. Be nice and tall for me. Okay. You're about 5'9". All right, you can take a seat. Actually, before you take a seat, I need to take another calculation. This is your waist circumference, so if you could just hold your arms out for me, please. Sorry if I get up in your business. Okay, you are 82 centimeters. All right, now you can go take a seat. And I'm going to use this information that I just got, and I'm going to calculate your BMI and your ideal body weight, which your ideal body weight should be about 154 pounds, considering just your height, and that's about it. That's not adding in any muscle or anything, so that's not really anything to really go by. But I'm going to use that, and I'm also going to calculate your percent weight change. So I'll do that later. All right, so I'm going to explain to you a little bit about what I'm going to do today. Is that okay? Okay, so what I'm going to do is I'm performing a nutrition-focused physical exam. Do you know what that is?
No.
It's a head-to-toe assessment of your nutrition status to see if you're at risk for malnutrition or any other nutrient problems. So I'm going to just ensure privacy so that it's just both of us. And I also want to let you know, if you ever feel uncomfortable during this process, feel free to stop me at any time. And I also, a little bit about what I'm going to do. I'm mostly assessing you for fat loss and muscle loss, but I'm also going to do just a little bit of an assessment on your hair, skin, and nails, and listen to your respiratory sounds and other things. Is that okay? Okay, thank you. So I'm going to just start off. Let me sanitize my hands real quick before I touch you, if that's okay. All right, and could you take off your hat for me, please? All right, I'm going to look at your hair, and what I'm looking for is the thickness, the distribution of it, if there's any hair loss present, and the color. And you have nice thick hair. I don't see any hair loss, and it's a good shiny color. All right, the next thing I'm going to do is I'm going to look at your skin. I'm looking for any lesions, bruises, or scratches. All right, I'm just going to look at your face first, then your neck. Can you hold out your arms for me? Okay. Don't see anything. skin looks good. I didn't see anything abnormal. And now, could you hold out your nails? I'm just going to look at your nails and see if they have a nice shape to them, if there's no clubbing present, which could indicate a poor oxygen status. And I'm also looking to see the color of them, so the cyanosis, if there was any blue, which that's what that means. And while I'm at it, I'm going to check for your capillary refill, and it should be less than 2 seconds. So I'm just going to mash down on your fingertip. Okay, and it was less than 2 seconds. All right, now I'm just going to look at your face. And I'm going to look at your eyes first, and then I'm going to look at your lips, your tongue, and your gums. All right, and then your neck. All right, so to start with your eyes, can you follow the pen? Okay, can you open your eyes wide for me? I'm just looking at the inner corners, the conjunctiva, that's what it's called, and if there's any paleness, which would indicate anemia, there's not. And then I'm looking at the whites around your eyes, which is called the sclera, and if there's any yellowing, which would indicate jaundice, so any liver problems, and they look nice and white. All right, now I'm going to look at your lips. I'm looking to see if there's no cracking, and if there is good moisture, and if there was cracking, that could indicate something like dehydration, and there's not. You have nice smooth lips, and the color is a nice pink color. It's not pale, and if they were pale, that could be anemia. So do you mind if opening your mouth so I can see your tongue? Okay, I'm just looking to see if your tongue is not glossy or smooth, and it's not swollen, and it's also not pale. So it's nice and pink, and it has the bumps that are present that would be normal. All right, and also, can I see your gums? So open your mouth wide up for me. All right, I'm just looking at your gums to see if there's the color is a nice pink color and it's not pale. Paleness would indicate anemia, and it's nice and pink, and there is no bleeding, or it's not bleeding. So that's also good. So everything on your face looks good to me. So now I'm going to just be listening to your respiratory sounds. Is that okay? All right. All right, can you sit up tall for me? Breathe in. Breathe in. Breathe in. Breathe in. Breathe in. Okay. And I'm just going to check your respiratory rate, so just breathe normally for me. Okay. It was about 25 breaths per minute, which is a little fast. The normal is about 15 to 20 breaths a minute, but with you having chest pain, a common symptom from that is an increased respiratory rate. All right, now I'm going to look and see if you have any fluid accumulation, and that's called edema. And where that happens is usually in your feet, your ankles, your hands, your wrist, and it can accumulate in your tummies. So I'm just going to look at your feet, and I'm going to press down for 5 seconds. All right, and there's no edema. I'm going to do your other foot. I don't see any edema. Sometimes you can see it. And there was nothing. All right, I'm just checking your ankles. Nothing. Nothing. All right, can I see your hands? Nothing. 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 All right, you have no edema in your extremities. That if you did, that would indicate heart problems possibly. So you have nothing to worry about right there. Now I'm just going to look at your stomach. So if you don't mind, could you raise your shirt up for me? All right, I'm just going to gently palpitate the area. All right, and there was no swelling. Can you keep your shirt up? Because I'm going to listen for your bowel sounds now. Okay, your bowel sounds were good. There was no abnormal sounds. They were present in all 4 quadrants, so that's good. Nothing to worry about there. All right, and so the next thing that I'm going to do is I'm going to be assessing for your fat loss, if you have any fat loss. So this will require me looking at this region. So if you don't mind, could you take off your shirt for me, please? But if you don't feel comfortable to do so, you don't have to.
Sure.
Okay, so the first thing that I'm going to look at is your eyes. So I'm going to just gently press the corners around your eyes. You have good fat pads, so there's no fat loss in that region. And also I don't see any dark circles or sunken in appearance, so that's also good because that would indicate a form of malnutrition. All right, the next part of your body. Also, before I ask this, what part of the body did your stroke affect?
Just most of my right side.
Okay. All right, so what I'm going to look at next is I am going to look at this part. All right, if I pull down, I shouldn't be able to feel my thumb and my index finger touching because that could indicate fat loss in this. And I don't feel it. All right, and that's your triceps. All right, now I'm going to assess this arm as well. So rest your arm right here, and I'm going to pull down, and I feel fat right there. So you haven't lost any fat on your left side in your triceps, but you have lost a little bit of fat in your right. But that makes sense since it mostly affected your right side, the stroke did. All right, now I'm going to just look at your middle section, your abdominal region, and I'm just seeing if you have fat stores right there, and you do. All right, and could you turn your back for me? I'm going to look at your lumbar region. And I'm just going to gently just pinch and see if I can grab some fat. And I can. So you have no fat loss, and I don't see your ribs exposed, so that's a good sign. That would also indicate chronic malnutrition. Okay, and that's all for the fat loss. The next thing that I'm going to do is I'm going to look and see if you've had any muscle loss. Okay, and I'm going to start with your temples. So your temporal area. I'm just going to look and I'm going to feel and see if I can feel that muscle around your temporal. And I feel it. All right, I feel a muscle there. And it's not sunken, so that's good, because if there was malnutrition in that area or muscle loss, I would see like a sunken appearance, and I don't see that. All right, the next thing I'm going to do is, could you just hold your shoulders back, and I'm going to look at the clavicle area, and your clavicle is not exposed, which is a very good sign. If it was, and I feel a lot of muscle right there. If it was, that would also indicate muscle loss. I'm just grabbing the region, and I'm also, while I'm at it, I'm going to feel around right here. You have, it looks like on your right side, it's more prominent. Like I see your chromium process sticking out. So I see that you've lost some muscle on that side. But that's most likely because you had a stroke and it affected that side. Okay? And now I'm going to look at this side, and I'm just going to feel, and it's round, and I don't see your chromium process sticking out, which is an indication of your good muscle right there. All right? The next part of your body is your scapula. So if you could, I'm going to ask you to stand up right here and just push against the wall. Okay, I see muscle. I feel muscle. I'm looking at this region, and your scapulas, so your shoulder bones, are not sticking out. If they were sticking out, that would indicate muscle loss, severe muscle loss. So you have a good muscle accumulation right there. All right, you can take a seat. All right, so the next part is your hand. So you have this little tiny knot in your hand, and it's called your osseous muscle. So can you make an OK symbol for me? And I'm just going to be assessing that muscle in that hand. Okay. So I don't feel a big muscle. There should be a bulge right there. So that suggests that you have lost a little bit of muscle right there. It's more sunken in and squishy, and I didn't feel good muscle. So now let me look at this hand and do the OK. Okay, I feel a good muscle right there. There's a bulge. I am feeling a hard muscle, and I don't see any sunken appearance. All right, now what I'm going to ask you to do is to lie down, and I'm going to look at your legs. Okay, so to begin, I'm going to start with your patella. So your patella is your knee, if you didn't know. And I'm just looking to see if it's sticking out. If you can see that bony patella bone sticking out, that means that you have some muscle loss right there. And it's probably you've had for a while. Which I do see some, but it doesn't look like it's significant. All right, I'm going to look at this side now. Okay, this side is nice and more round, and I see that you have good muscle in that area. Okay, the next part is I'm going to look at your inner thighs. So this is where you carry your strength. So if you were to have a stroke and it did affect your right side, you're more likely to experience muscle loss in this region. So I do see a sunken appearance, and your bone, your femur bone is sticking out more than this leg. And I'm feeling around, and this leg has good muscle right here, but this leg is softer, and I'm feeling more bone than I am muscle. Okay, and could you hold your knee up for me? I'm just assessing your calf muscle now. If you can just kind of squeeze it. Okay. Just like I said with this side of your leg, this leg is not, the calf region is smaller, and it's not like as big. It's supposed to be a nice round size, and it's kind of small, but that's most likely because you had a stroke. All right, could you do your other leg, please? Okay, I'm feeling a nice muscle right there. There's a nice round muscle. It's much more rounder than your other muscle. So that's good. All right, you can sit up for me. So a little bit about today. First off, I would like to thank you so much for allowing me to complete this nutrition-focused physical exam on you. From what I observed, you didn't really have any fat loss, but you had more muscle loss than you did. And that's most likely why you've lost 10 pounds in a month. And it did affect your right side because I saw that you were having muscle loss in your deltoid, your shoulder. I saw you had some, you did have some fat loss in your triceps. That's the only place I noticed where you had some fat loss. You also had some muscle loss in your right leg. So in your calf, in your inner thigh, and your patella. But it wasn't like a significant amount. So we can fix this by adding more protein to your diet, but we would like to also focus on things that you can chew and swallow because you're having trouble with this. So I would suggest foods such as like to be able to gain some of that weight back, just eating. I'm assuming, tell me if I'm wrong, I'm assuming you're having trouble swallowing and you're not eating most of your food. So you're probably most likely not consuming enough calories. So we would need to focus more on soft foods such as applesauce, things that you can easily swallow, like mashed bananas. If you want bananas, scramble your eggs instead of frying them, and switch to softer protein options, or grinding your meat, like for example shredded chicken instead of chicken on the bone. But I'm going to use all of this information, and I'm going to talk to the doctor, and I'm also going to put this in the charts. Let me know if you have any questions. Do you have any questions?
No, I do not.
Okay, well that's perfect. And I'm so glad I got to meet you today. And I hope you have a great rest of your day.
You too.